if some patient comes to you and he has some like really bad sickness, and do you think that he must choose between Ayurveda or allopathic medicine because they don't complement each other in treatment of this specific disease, if you know what I mean? You know, because sometimes they contradict. Ayurveda wants to make detox and stuff, but on the other side, allopathic medicine tries to give, like, I don't know, chemotherapy, strong tablets, some operations. Does it? Do they have to choose? You know, do they have to choose which way to go?
Okay, now that question depends, the kind of disease they have, the stage of the disease they have, how long they have been taking that particular medicine, how long are they following everything, and what is the ultimate or sole requirement. There are patients who have made silly mistakes, let's say in chemotherapy, because certain medications, let's say, I'll give you an example that if somebody is given an antibiotic for any let's say sore throat or any infection in the throat, and if they take only 1 or 2 tablets, they are better, and then they stop it. Okay, so then it develops a resistance in the body, so next time you would need a higher antibiotic. Okay, so certain medications in allopathic, when they are advised to be taken, one has to finish the course. Okay, another thing is the patient's diet, lifestyle, everything has to be taken into consideration. Let's say if somebody is having an autoimmune condition, which I am the master of treating, or let's say incurable disease, where they have been taking medicines for, let's say, 6 months, 1 year, and their body has become habituated to it. So if you try to stop them just in one shot or haphazardly, so if you just stop it, the body will show the withdrawal effects of the medicine, so you cannot do that. You have to slowly, Ayurveda medicine will complement whatever it is going on. Okay. That it will help you get the speedy recovery. It will start, because see, sometimes allopathic would be, most time allopathic would be palliating the symptoms, and it will definitely give you the relief from something from time being. Okay, so
but
that
with a
is,
price, in a long
of
term.
course,
Yeah.
long term. But let's say, I have seen, that I treat many incurable and this autoimmune challenging condition, and I have seen there are certain people, they have stopped it haphazardly and they have suffered from withdrawal effects, and ultimately they have to again go on to allopathic to bring the immediate relief. But that, like I said, again on the higher price, so they have been advised more stronger medication.
Yeah.
So what I would do, this is my personal experience, and I can also give you an example of one of my patient. I have never seen her. She's in Australia. She was suffering from lupus psychosis. Okay, now they are from Kerala. Now Kerala is very famous for Ayurveda. People are going there for different panchakarma, and there's the nice seaside, and people can enjoy. So it's a medical hub, Ayurveda hub. So there are also very famous Ayurveda doctors. Now she went to two Ayurveda doctors. They both were like, you stop your ongoing allopathic treatment and now you start ours. Ultimately, she suffered more. And by the time she came to me, so earlier she used to take maybe 2 or 3 allopathic medication. And by the time she came to me, she was almost on 12 medications. So
Oh
you
my
see
God.
that, when they do it haphazardly. So see, this is a science, one has to give it a scientific approach. So what I did, the treatment was going on parallel, simultaneously. My treatment was also given. I gave the diet, lifestyle modification. I advised the panchakarma, different massages. Ultimately, the root cause was being addressed. At the same time, we were also giving the treatment for immunomodulation and treatment, the symptom specific treatment. So ultimately, she was recovering. And on the next visit to her allopathic doctor, they were surprised that she has shown a recovery. So they were able to take up the Western medicine slowly. But let's say if you stop your Western medicine in one shot and you are taking Ayurveda, and maybe sometime, like I said, it can take time because it depends on the patient's history, the stage of the disease, and many other factors. So the condition was worsened. Let's say if condition got worse, and then you go to your Western medicine, they have no choice. They have to only increase the dose. So if somebody has to, like, let's say, integrate Ayurveda and allopathic, that's okay, but it has to be done under the medical supervision, and the reports and everything of that patient of mine is completely came out fine. And today I am proudly saying that she got cured from her lupus psychosis, and she does not need any medication. But yes, while she was on the allopathic medication, she suffered from avascular necrosis of the leg. So that was there. So like you said, there is a price. Yes, there is a price, but depends. Like I said, there are many factors which would contribute or give us an idea what should be done. But for the small, issues, let's say when you say headaches, but you need to address the root cause. That why do you have the headaches? You can't just pop up the pill all the time. So if
Mm.
you are on that kind of lifestyle, that okay, you have headache, you have sinus, you took the painkillers, or you took antibiotic, ultimately you are ruining your body's natural intelligence.
Yes.
An ultimate goal with the Ayurveda, that you change your diet, you change your lifestyle, do it for the better. So this minimum changes will give you the maximum benefit.